All right, let's get started. Good morning, everyone, and welcome to our encore of Shifting Healthcare Forward. This session is really special to us. We presented live at SHRM21 in Las Vegas just about a week and a half ago, nearly standing room only. The engagement was just off the chart, heads nodding, and just a lot of, really kind of leaning into this conversation in terms of, man, this is what I've been waiting for. So, by attendee request, they wanted us to present again. So here we are making this session available to the entire industry. And we're so happy to dive in and have you all here. We are going to do 40 minutes of fast content presented by two self-funding experts. And then we'll leave some time for Q&A. You can submit your questions into the Q&A box throughout the presentation, and we'll address those questions during the dedicated Q&A session right before we let you guys go and give you your day back. Thank you again for joining us, and it is my pleasure to introduce Keith Lemmer to kick us off. Keith.
Terrific. Thank you, Megan. Thanks for having us, and glad you all are joining us today. How we got here. Johnny Taylor, the CEO of SHRM, Society of Human Resource Managers, actually approached me several months ago and said, I've been hearing about Wellnet. I've been hearing about this opt-out strategy. And I really think that you all should do a session at our upcoming SHRM21 in Las Vegas. And so with that, we put together a deck that I think solves some of the nation's healthcare cost problems, quality, and really, Johnny actually talked about this at the SHRM conference, is leading with bravery, leading with empathy, and really being the architect of your health plan, because healthcare costs, as we know it, are truly unaffordable. So today we're going to cover how C-suites are fixing healthcare for their people and leveraging, as we like to say, a change management journey. So the focus, this session is going to give you a talk track and a narrative, and to present how you can actually have a conversation between your broker, your HR, your CFO, and anybody in the C-suite in regards to an opt-out strategy. What does that mean, opt-out? Opt-out means moving away from the large traditional health insurance companies as we know it, right? If you're with those companies, you're traditionally seeing a 10 to 25% increase. It's an unaffordable mess. And even Axios yesterday, one of the news sources of the nation, reported record profits of the health insurance companies and the health systems and all of the dollars that they're making, no matter what's going on in the marketplace. And what are companies looking to do now? They're looking to preserve cash. They're looking to reduce expenses, but they're also looking to improve the culture of their company. We did a survey several months ago to our broker population, and about 90% of them thought that the large insurance companies did not have the best interest of their customers in mind, right? Over almost 90%. That is unconscionable. So what do you do about it? That's the interesting thing. And if you take a step back for just a moment, right? Everybody says the healthcare system is broken, right? It's broken. We've got to do something about it. We've got to fix it. The healthcare system is not broken. It's really working exactly as those that designed it intended, right? The health insurance companies, the health systems, the large pharmacy benefit managers, and others that surround the system. The more that companies spend, the more claims that are utilized, the higher that those premiums, whether they be fully insured or stop loss premiums, can go. So what to know today? So, right? Healthcare is unaffordable. The cost for a family of four is almost $20,000. That's like buying a brand new car for each one of your employees. And that's before deductibles. And the reality, right, and we're going to dig into this today in a little bit, is the difference in provider quality. That's one of the most significant drivers, is the cost and the quality. We're really going to take today and demonstrate the disparity with examples of high and low cost and how you can actually dig in and find higher quality, lower cost, and communicate that proactively to your membership. And then also an insight. There's just a tremendous lack of transparency, right? You may get some high level data, but what do you do about it? Companies need today data and visibility to manage their plan like they manage every other aspect of their organization. So here's what you're going to learn today. We're going to frame up the self-funded journey, how to fix the unaffordable healthcare mess with ongoing education, stronger advocacy, aligned incentives to combat the vested interest of lots of the large carriers that we know today. Also, we're going to dig into how to really build a health plan that's right for your company or for your customer. And then how to leverage case studies and success stories, no matter what industry, what size, or location you currently are in. So our background and why we're here today. We're almost 30 years old, privately held company. We have almost 500 customers that allow us to micromanage their benefit plan and provide the highest quality of service. A 98% retention rate has led us to the following: a net promoter score, an NPS score of 82, which is almost 4 times the industry average of our closest competitor. What does that really mean, NPS? It boils down to this: how likely is someone to recommend, a customer or partner, to recommend your company to somebody else? Again, 4 times the industry average of our closest competitor. Today's about meeting you where you are, right? Every employer has a different journey. They have a different appetite for savings, a different appetite for risk, and their ability to communicate change. Employers do not want to be forced into an uncomfortable solution. They're looking for a pathway, right? How much can I save and how long will it take me to get there? Some want immediate change, some want gradual over time. And so we've developed, and John Augustine is going to share some of this in a moment, kind of this crawl, walk, run strategy, meeting customers where they are, no matter their size, their location, their culture, or their industry. And with that, I'm going to turn the floor over to John Augustine, Senior Vice President of Wellnet Healthcare. John?
Thank you, Keith. So I'm sure everyone has seen some version of this slide, and I think a lot of times this gets lost on us because a lot of the times the people that have this conversation that look at this slide are higher income earners. And we fail to realize the impact that this has on the average American, the people that are enrolled in our plans, the insured members that we represent. When we first got into this business, it was all about the people. It was about how do we solve problems for members? How do we give them a plan that they love, a plan that works for them? If you really start to translate this and you see that, people have gotten raises over the last 10 years, but the deductibles, the premium contributions are far more than offsetting that wage increase. For the most part, people are earning or taking home less money today than they were 10 years ago. And a lot of that can be attributed, most of that can be attributed to the cost of health insurance in the form of premiums and in the form of cost sharing. This is a terrible situation that we've all gotten ourselves into. And the solutions that got us here cannot be the ones that get us out. That's Einstein's definition of insanity. One of the things, as Keith mentioned, that Johnny Taylor talked about in his keynote address out in SHRM was empathizing. Remember what it was like to barely be able to put food on your table. Remember what it was like to have 4 kids, 2 of them in daycare, the other 2 you can't afford daycare, so you got family raising them. This is what employees deal with. And yet each year we raise their deductibles more and more. That's not anyone's fault here. That was the only way you could control a premium. But what we're going to do today is show you how to improve benefits while simultaneously lowering costs. There's a couple of key concepts that we're going to talk about today. One is optimizing. The national carriers, as Keith alluded to, optimize health plans for their shareholders. Our healthcare system's not broken. It's perfect for them. We're going to show you how to optimize health plans for consultants and for employers. That makes sense. But to do that, you've got to opt out of the plans managed by the national carriers. And those plans feel so warm and fuzzy. We're going to show you how we can improve the warm and fuzzy feeling through our opt-out strategy. The other main concept we're going to talk about today is proactive versus reactive. The national carrier model is totally reactive. And you guys know what I mean. At the 9 or 10 month mark, you get your renewal and you say, holy cow, what do I do now? Raise deductibles, raise premium contributions. That's your only tool that they give you to control cost, generally speaking. So we're going to talk about a proactive strategy that enables an employer and a consultant to work together to put plans in place that reduce the cost of claims. Claims are what drive up premiums. But there's a couple of huge disconnects, and we're going to talk about them. There's actually, in my mind, 3 areas where the national carriers have significantly optimized plans for their benefit. And we're going to take those 3 concepts and talk about how you can optimize those plans for your benefit. Now, I'll leave you with this. I'll start with this thought. Imagine being able to offer your employees an option, a voluntary option of free healthcare, no deductible. If you polled your employees, every single one of them would rather pay 0 deductible than any deductible, whether it's $100 or $5,000, regardless of the income level of those employees. No matter how much money someone makes, they'd rather pay nothing than a big deductible. We do that in all of our other lines of insurance. I was just thinking this morning, I'll bet most of the people on this line have a lower auto insurance deductible than their health insurance deductible. And that's crazy. When do you use your auto insurance? And yet your deductible is lower on that than it is for your health insurance. Imagine being able to offer employees a voluntary choice to not have to pay their deductible. And that's what we're showing you here. This really comes down to the simplest education that you've ever had to do to your employees. Dore with Wellnet is the same exact plan designs that you had last year with Blue Cross. Because Wellnet's an independent third-party administrator, we can mirror the plan designs that you have. We can use a big PPO network. So it's going to feel all warm and fuzzy to your people. We're mirroring the plan designs. And Dore is your employees do whatever they want whenever they want. They'll pay the same exact copays and same exact deductibles with Wellnet than they did last year with Blue Cross. All we're doing is giving them that voluntary path, that choice. Dore B. Dore B is where you call a Wellnet concierge advocate, have a conversation with that advocate about the quality of the providers around you. That might be a provider you want to self-direct yourself to, a provider your specialist referred you to. But Wellnet, whenever you call us, we're always going to give you an option where it doesn't cost you anything. If you self-direct your care, you pay your deductible. If you use a high-quality provider Wellnet suggests, it's free. This isn't rocket science. That's what every employee wants. The challenge is the carriers' plans are optimized for them, and they don't allow this. And so what a simple opportunity that is. And now this is the first of the 3 concepts where the employers are optimizing plans for their benefit and not to your benefit. So the first of them is the medical loss ratio requirement. When the Affordable Care Act passed in 2010, President Obama thought to himself, well, let's put in a regulation that limits the renewal increases of the carriers. Great idea. Problem was, he put in a regulation that basically says to the carrier, you can only keep, I'm now talking large group, you can only keep 15% of the premium you're charging. The other 85% has to get paid out in the form of claims. So what he did is limit the margins an insurance carrier can keep on the premiums they charge. They can only keep 15%. These are, for the most part, publicly traded companies. They need their premiums to go up every year. That's the lion's share of their revenues. But Obama capped their margins at 15%. So how do they make more money each year using just this basic argument? Well, they have to make the premium bigger. So their 15% gets bigger. But if you read between the lines, the only way the premium can go up is if the claims go up. Because every state now, through the ACA, has to approve the rate increases for fully insured plans. And so each state must review the desired increase from the insurance carriers, and they're going to weigh out, well, are your claims projected to be 85% of the premium you're charging? They need claims to go up to make more money. Now, this is a conversation about being self-funded. Why do I say this? Because most employers, most consultants are using the national carriers to administer their self-funded health plans. And I think many of us think, well, the MLR doesn't apply to self-funding. You're right, it doesn't, except you're hiring that same entity who thinks like that on the lion's share of their business to manage your self-funded health plan. They're not going to change the way they think. Carriers don't want to lower claims. That's a pretty important concept that people need to get their head around. You're never going to lower claims. And I guess proof of that is look back over your history of working with national carriers. Maybe 1 out of 10 years, your rates go down. 1 out of 5 years, they hold, but all the other years they're going up. They don't want to lower your claim costs. You know, it's funny to me. I've been doing this a long time, and you see these carrier reps every year, and every year they tell you about all the cool things they're doing to lower costs. If any of that worked, wouldn't your premiums go down? If any of it worked, wouldn't the premiums go down? It doesn't work. Your premiums keep going up. You and I both know it. The biggest challenge, and this is why Johnny's speech was about what it is you need to have the bravery to opt out of those solutions. The second key concept that I'll use this slide for is to talk about pooling. There's a couple of things we can talk about on this slide, one of them being self-funding in general and how that benefits versus fully insured. But let's just talk pooling for a moment. This will sound familiar, okay? Your client gets a 8% renewal from the carrier, and you say something like, well, their loss ratio is only 50%. How are you giving me an 8% increase when you guys made so much money? And the response is you're pooled. Okay. But then the next year you get a 25% increase and you say, well, whoa, 25%. I thought we were pooled. And they say you are, but you know, you're somewhat credible. So the pooling's hurting you. It's hurting you virtually every single year in a national carrier environment. And whether or not you believe that, this fact is true. When you're in a pooled environment, when you lower your claims, there is no direct correlation to lowering your cost. In other words, if you go from an 85% loss ratio to a 30% loss ratio with Blue Cross, you're still getting that rate increase. They're going to try. And you may negotiate it down to 1 or 2 or 3%, but it keeps going up. In our world, in a world where you manage things proactively, being outside of a pool, being on your own, it might seem scary at first, but only if you're not managing anything. If you're actually proactively managing your plan and you're not in a pooled environment and you lower your claims by 50%, you're going to see a pretty significant rate reduction at renewal because you're not in a pool. The data is what the data is. And that's why working together as a team, the consultant, the employer, the TPA at Wellnet, to build a plan that outperforms, that's your key to lowering costs now and into the future. You've got to lower your claim costs. And generally speaking, you got to be outside of that pool. Certainly there's pooled environments that make sense, like captives and things like that. But there's plenty of arguments to be made to run outside of that pool. You go to the next slide, Keith. This is the dirtiest little secret in healthcare. And deep down, you all know this, but the carriers don't let you take advantage of this, not the way we do. In the same town, in the same exact PPO network, every provider is getting paid something different for the same service. People, this is the lowest hanging fruit in healthcare. And the example we have here is not that extreme of an example, although it might feel that way to you guys. In the same town where we pulled this example, the lowest PPO price for a hip replacement was $23,000. The highest price was $92,000. That's the after discount PPO price. That's the final price the PPO is making. Same PPO, same town, same procedure. If you're an employer, obviously you don't want to be spending $93,000 on a hip replacement if you could get it done for $23,000. This is the opportunity to offer free healthcare to your people on a voluntary basis. Door A, your people self-direct their care. Go wherever you want. Go to the $92,000 thing, but that's why you're paying your deductible. If you're willing to be steered to a higher quality provider that is significantly lower priced, we're going to pay your deductible for you. This isn't rocket science. You just have to have a partner that can do this for you. Now, the average market variance on that's 445% when you look at count these other two procedures. If you applied that same 445% variance to the cost of gasoline, it becomes laughable all of a sudden. No one in the world would spend $11 on a gallon of gas, unless you're in a country that's what it costs, but not here in America. So why would you spend that much on a knee or hip replacement if you know you could get it at a fraction of the cost? The reason is because you didn't know this or you don't have the tools to allow for this. Wellnet optimizes health plans for our consultants and our clients. We make the data transparent so that you understand and you can build more efficient health plans. And and this is why I started the way I started. A lot of times we focus on cost for the employer. That's true. But put the member back in here, man. The member wants the highest quality care, which I'm going to show you how to access in just a moment. And the member wants the lowest possible cost. You can solve for that with the right administrator. You can't solve for that with the national carriers. Next slide. So Wellnet's got over 20 ways that we help optimize the health plan. And you're seeing them on this slide. Most of these tools also give you an opportunity to give away care for free. I'll just highlight a few of these. On the left-hand side of your screen, international pharmacy outsourcing. Drugs that we can ship in from other countries like Canada cost way less. They're the same drugs. They're the same manufacturer plant here in the US. They ship them to Canada. We ship them back in. On average, it saves somewhere between 40 and 60% for every one of those drugs. That gives you a chance to give the drug away for free. Voluntary members don't have to do that. It's just a voluntary option. Down at the bottom, telemedicine. Telemedicine should be offered for free to every member. Absolutely free. So that when they talk to a specialist, a nutritionist, a psychologist, a psychiatrist, it's all free. Because that's how healthcare should be. And you guys have the ability to build it that way. Things like dialysis carve-outs, transplant carve-outs. I'm going to show you some examples in just a moment. These are all different ways. And in the middle, you see this continuum of crawl, walk, and run. As Keith said, we meet you where you are. The simplest thing you can do right now is to just hire a company like a Wellnet, allow us to mirror the plan designs you've got, and then offer your employees that door B. If you're willing to speak with a Wellnet concierge advocate and allow them to book your deductible related appointments and source certain high cost medications for you, totally free. We care about you. We listened. We know you don't like the big deductibles. We know you'd rather have free healthcare than pay money. And so we're giving you that voluntary path. This is the start. That's meeting you right where you are. And then once you get that, once you start to see all this data, you'll be alarmed and you'll say, what else can we do? Can't we do this? Can't we do that? Yes. So many times, I'm sure folks have come in, you might see way on the right side of your screen, and talked about reference-based pricing. You want to save a ton of money, that's your ticket. The problem is that's the moon. You're here on Earth and that's the moon. And so more often than not, when employers hear about reference-based pricing, they just don't want to implement it. It's too far-fetched, at least for now. So we give you the ability to meet you where you are and then evolve your plan at a pace that makes the most sense for your employees and in ways that make the most sense for your unique employee population. So we've got all these tools. So as not to confuse you, we bundled these tools into 3 distinct packages. Again, crawl, walk, and run. These are all editable, if you will, customizable, but in really simple terms, here they are. So the crawl, we package a bunch of stuff together. The walk option gets all that crawl stuff, plus these items that you're seeing. And then the run option gets every single thing Wellnet does lumped into that plan. You got us in our run option, just all systems go, controlling your claims and trying to give away free healthcare as often as we can to your people. We can deliver huge cost savings at a pace that makes the most sense for your people and in ways that make the most sense for your people. It's funny, when I was out at SHRM, they have a new conference center they built in Vegas. And Vegas is confusing as it is, even though it's all centered around the Strip because the hotels are so big. I used GPS in my hotel. I was using Google Maps to find Starbucks. I then used my GPS on my phone to find the convention center. And here we are in a health insurance plan, this arguably the single most important life events that happen to our families. Someone very close to me years ago, a few years ago, she's fine now, or at least cancer-free, was diagnosed with breast cancer. Well, I was one of the first people she called. She's not a Wellnet member, but she knew that I have resources at my company that helps people find the very best doctors for exactly what they need. She needed an oncologist to treat a very specific type of breast cancer. We did some research for her and found her an oncologist at Johns Hopkins. She balanced all the information she had in hand, the references that her doctor gave her, her specialist, and what we gave her. And she decided to use that specialist oncologist down at Johns Hopkins. Imagine being able to give that to your people. That's what we're talking about. It's not all about the money. It's about a better healthcare experience. Jen needed to get better as quickly as she could for her and her family. You don't want to leave that care to some referral your doctor gave. I'm not suggesting you don't listen to your doctor. I'm not saying that at all. I'm just saying ask a few more questions. Is your doctor owned by the local hospital? Most of us don't know that. Regardless of what you believe about our healthcare system, wouldn't it be great to be able to give your people an option where they have someone on the other end of the phone that is nothing but an advocate for them? Keith, why are you calling? What can I help you with? And we learn, we listen to your member, and then we advocate on their behalf. Oh, you need an oncologist to treat this very specific type of cancer? How far are you willing to drive? Et cetera, et cetera. So Wellnet's concierge advocates are the GPS of healthcare. It's a live voice at the other end of the phone who's there to support you with whatever you need. Next slide. Again, this doesn't have to be confusing. Lots of time when we talk about all this stuff, people think, well, how are my employees going to get this? They don't even understand an HSA. Well, no wonder, that's confusing. What's not confusing is your deductible is $2,000 if you self-direct your care. It's free if you call Wellnet. That's really easy. Everyone gets that. And again, the higher paid the employee, arguably, the more interested they would be in this, because you could argue they're more educated. On the flip side, a totally blue-collar workforce, a workforce who might be first language, another language, not English. They really want the help. They'll listen to anyone if they can get good care for zero price. So it's just about giving people that voluntary option. The way that we do this is we have a squad, we call it. It's led by the account manager. That account manager is proactively looking at the claims utilization, looking for opportunities for us to use our 20+ tools. And they work in tandem with 3 different types of advocates that we have on staff: clinical advocates, care promoters, and customer care advocates. So we will make proactive outbound phone calls if we uncover the opportunities, but we're also there to answer that phone when someone says, I want to go through door B. Unlike many other companies that do advocacy, we in-house this. So these are our own employees based out of the Philadelphia area. And you're not supposed to be able to read everything on the right-hand side of the screen. This is designed for you to understand that we track every single thing that happens in our advocacy program. Every single phone call is recorded and it's all reportable. So at the end of every month, or more often if desired, we will provide an advocacy report that shows you all the calls that came in, the topics of those phone calls, and the results. And armed with that data, all of us as a team can make better decisions, adjust the program, evolve it at a pace that makes the most sense for your people and in ways that make the most sense for your people. So here's 3 different outcomes. When we were out in Vegas, we had the Orisman team join us via video. They weren't able to show up in person, but we used 3 of their case studies. This is the first one. So there were 4 drugs that people were taking that we could source through either assistance programs or through international mail. And you can see the savings was $66,000. These are the same drugs for the members. Same manufacturer, member paid nothing, Orisman saved $66,000. This is a no-brainer. You just have to have the right partner. The second example here, and it starts with the member opportunity. Remember, empathy. Your people don't want to pay their copays and deductibles, but they also don't want to be told what to do. So you just give them that option, door B. It's voluntary. This member for Orisman, they had 2 different plans you're going to see here in a minute. $3,000 deductible, 80% coinsurance to a max of $6,000. This member was on dialysis, heavy dialysis, and the PPO rates for that dialysis was $775,000. I thought that was an anomaly until last week. I saw another case come in where the member's dialysis was approaching $800,000 a year. This is real stuff. This is the kind of stuff that makes people say, This isn't the right group for self-funding because the risk is terrible. That's because you didn't have a plan in place. Every single high-cost claim that could be occurred, maybe not every single one, but virtually every high-cost claim that could be incurred, you could build a path, a voluntary path. If you do it this way, it's free because we can do it for way less money. So all you have to do is find a partner that can help you plan for all these things, proactive versus reactive. The carriers love to come into your office each year and say, hey, unfortunately, 22% increase because look how bad the claims experience was. We love to say, look at all these tools we have to reduce future claims exposure if these things happen. What a huge difference that is. So in this case, the member got to continue to see the same dialysis provider. We didn't have to change providers, same provider, because of the way we pay that provider in this case, which was a Medicare-based payment instead of a PPO-based payment. Oarsman ended up only having to pay $76,000 for that dialysis treatment, but they also chose to pick up the members' full out-of-pocket cost, which was the full $6,000, and so the plan ended up saving $693,000. One claimant, one tool that we're using. And then this next slide is something that happens very common. Not that a kidney transplant is common, but a surgery of some kind. Every company has lots of these each year. And these are all opportunities where the member could have paid nothing and you could have gotten a better outcome. As I'm thinking about this, one of the slides that we actually didn't include in this presentation is how we start to steer for quality. So we've got a variety of tools at our disposal that we can help a member solve for quality. And we use those tools behind the scenes, but then we share those results with the member. And so the member's armed with all this information, like that breast cancer example I shared with you earlier, and the member makes the right decision for their family. Ultimately, everyone on this phone probably wants them to choose door B, but I don't care. The biggest value for me, what drives me every single day, why I'm so passionate about this, is because everyone in your organization deserves this choice. They deserve to have a choice to pay nothing. Leave it to them. Medical claims are the leading cause of bankruptcy in the United States. And not everyone, most of those people have insurance. We've got to do things differently. Deep down, we all know that. We've worked really hard and refined this over the years to make it work as well as it does. Our NPS score is 82. That's a measure of member satisfaction. How willing someone would be to refer a Wellnet to their family and friends. So in the case of this kidney example, our bundled contract that we have, because we have direct contracts and we can even build single case agreements when we need to, ended up being $167,000 instead of the PPO price of $325,000. Even after picking up the member's full out-of-pocket cost, the plan still saved $152,000. Claims drive renewals. Wellnet's clients are not pooled unless they happen to be using a captive. So for every dollar we reduce your claims, that's $1 that goes directly to your bottom line. There's a direct correlation in our world between claim reduction and cost reduction.
So in the case of Oarsman, John, thank you, by the way, terrific overview. So in the case of Oarsman, they've been a Wellnet customer for 5 years. They're one of the largest auto dealers in the nation, based in the Mid-Atlantic region. And so not only are they competing for talent with other auto dealers, they're competing with the federal government, with Amazon. And because of the savings they've achieved with Wellnet, over $2 million over a 5-year period, or a little less than $500,000 a year, they have not raised employee premium contributions for those 5 years. They've reinvested in training, they've reinvested in their people, and they are one of the leading organizations in terms of benefit planning, culture, and improvement, in addition to the savings. And so whether they're an auto dealer that's walking with us, or you have other groups that frankly are hospitality in the food, beverage, and hotel industry, saving $870,000, or a real estate finance company that builds and develops communities, saving $2 million that goes from crawl to walk, or you have a trucking organization that is an ESOP, right, where every employee has participation. This organization decided to go to a reference-based pricing plan, as John mentioned, right, Medicare Plus. This organization saved $8 million. That's almost $2 million a year over that 3-year period. And they're focusing on cost, quality, and they're doing it because the broker, the consultant, and the employer are all riding shotgun together with Wellnet. Actionable information. I read a study early this morning from Employee Benefit News, right? It's not helpful unless it actually tells you something. So in addition to the data Wellnet actually provides, there's always an action that's tied to it. All this information is available for the employer group, the consultant broker on live dashboards, and certainly available on mobile devices for employees. All these things are about engagement, culture, and communication. So what does it come down to, right? First, it's about taking action, right? What does that action really mean? What is your appetite, right? What is your readiness for change? If you're an employer group that's 100 employees or 500, or you're a broker consultant that is looking to bring strategic ideas, it's about having that conversation because nobody can afford the type of increases that you're seeing day in and day out. How do you actually do that, right? How do you go deeper? Does it make sense to even consider an opt-out strategy? The one thing that Wellnet does at no cost is we actually do what's called a Toolkit Analysis, right? We get a review and a file of all of your claims from a year or two prior, and we go through it line item by line item, and we look for areas of opportunity, cost savings, as well as how does that impact your culture? And before a group even begins, we show you, listen, we can save $500,000 or $2 million without even blinking. What are the immediate and long-term savings around that, right? Really important. And then the third is, and I saw a question that came in, does Wellnet work with brokers? Absolutely. Wellnet does not sell direct whatsoever, right? We message and we communicate and we provide thought leadership to the entire industry, right? Every single person that's responsible for making decisions, right? The broker consultant, the HR, the CFO, and the CEO. But what we do request and what we do require is a seat at the table to actually have all those parties, right? The executive team of the company, the broker and consultant, and Wellnet at the table, right? To provide the experience, the continuity, and the credibility of the things we've been doing for now almost 30 years. As John talked about, right? It's about a partnership, right? Great things in business are never done by one single person, right? They're done by a team of people, right? And that's the way that Wellnet looks at this. It's about partnering with the right organizations. It's about partnering with the right brokers and consultants. And it's about communicating and getting on the same page with every single person, right? This is the third or fourth biggest expense of every single company, right? Most organizations, they manage their travel and entertainment budgets, their paperclip and paper buying down to, a microscopic level. But that's not being done in the health insurance sector, right? Third or fourth biggest item. This is the one area when you take those dollars that are being saved and the savings that are achieved are typically about $2,000 per employee, or for a group of 100, right? That's $200,000 a year. For a group of 500, we're talking about $1 million. Imagine what you could do with those dollars. Not only reinvest in the company, reinvest in the culture, also improve the profit of the company, and in addition, have the ability to create higher valuation for that organization as well, right? The sky is the limit. So what does it come down to, right? SHRM asked us to complete this phrase, right? Now more than ever. And we said, now more than ever, you can control the uncontrollable. Thank you all for joining us. And with that, we'll open up the floor to questions. Megan?
Excellent. Thank you both. We do have a few questions, so we'll dive right in. Okay, so I'll ask the question and then Keith or John, you guys can answer it together, or kind of just one of you can take it away.
Sure.
For the self-insured employers, does Wellnet implement any anti-fraud healthcare solutions to make sure that the employer is not paying for fraudulent claims? Excuse me. If you can discuss or reference the solutions, that would be great.
Sure. So again, to reference what we talked about today, we employ this crawl, walk, run methodology. And inside of that are different types of solutions. For example, some of our solutions use a PPO network. Those PPO networks have different rules of engagement relative to what I'll refer to as medical bill review or claim auditing. So depending on the PPO network we're using will dictate what types of claims we are able to audit or review the medical bill. So the two networks that I'm thinking about right now, these are big national carrier networks, and they each have different rules of engagement. And so what I will say is the claims that they allow us to audit, we do audit to make sure there is no fraud going on. And that does save clients some money. When we use a plan that does not use a big national carrier network, or a plan that uses reference-based pricing, for example, and I'll speak specifically about that, we audit 100% of the claims. So to the extent possible, Wellnet is auditing every single claim, but often we're not allowed to audit all the claims through the PPO arrangements. And
John, do me a favor, elaborate just a touch in terms of the way that the traditional carriers do this with their auto adjudication systems.
All right, that's a good point. And this is a point that often gets lost on the industry. The carriers often brag about auto adjudication. Auto adjudication means a computer is paying a claim without a human ever looking at it. Hospitals hire people, consultants, to figure out how to get more and more claims paid, frankly, through the auto adjudication process. As long as a claim looks right to the computer pays it, for the most part. I'm simplifying this conversation. There needs to be struck a balance between auto adjudication and processing every claim manually. Obviously, if you processed every claim manually, you'd catch every single error that existed. You'd save your clients some money. The challenge is if you audited every claim, if you processed every claim manually, it would take forever. So you're trying to strike a balance between how many claims get auto adjudicated, which claims get auto adjudicated, and which claims get kicked out for manual review. So there should be a nice balance between manual claims processing and auto claims processing.
Terrific. Thank you. I see a question here, and Megan, I'm going to just jump into this one. It says, what provider network do you partner with? So Wellnet partners right now with Cigna and Aetna. And so they have some of the largest provider coverage in the nation. We also have direct contracts. And as John shared earlier, we do reference-based pricing as well. At the end of the day, right, it's really meaningless which provider networks that we offer. Some people say, well, gosh, I need Blue Cross because they have more doctors in the network, right? At the end of the day, right, we can contact any doctor that may have a minor lack of overlap and say, do you take cash, right? And pay them at their requested reimbursement rate. So the networks and the providers, they're nearly seamless. There's another one up here that I see. It says, does Wellnet work through brokers or does the concierge serve that role? So Wellnet, as I shared earlier, right, we market and communicate with CEOs, CFOs, and everybody in the ecosystem, including brokers and consultants, but we only partner with brokers and consultants to actually sell our solution. We do not sell directly.
What we found, though, to complement that answer is that the concierge advocates actually reduce the amount of phone calls HR is getting, and also reduces the amount of phone calls our consultants are getting. And again, all of that's reportable. So it's not like those calls disappear. They just get sent to Wellnet. We manage it. We'll share our phone call metrics with you, the advocacy calls, whatever you guys need to see to build and manage the plan appropriately.
Great, John. And I do see another question coming in. Okay, so this sounds a lot like what a carrier would offer. What is different about this model?
I'll go back to that word optimize. And I'm going to use Horizon Blue Cross for those of you on the East Coast as the perfect example. Horizon several years back came out with the Omnia network. It's a tiered network. If you use this network, it's lower cost for you, Mr. or Mrs. Employee. If you use these providers, it's higher cost. That sounds like what Wellnet just talked about. The difference is that's optimized for Horizon. Ours is optimized for you. Now, what do I mean by that? Everything we're doing is totally transparent. Everything Horizon did to build that Omnia network, when you guys do the research and fact check me on this, it'll open your eyes a little bit, because I wanted to fact check Horizon. I wanted to understand why Horizon built the Omnia network and how they built it. They didn't initially want to tell anyone, but a judge eventually forced Horizon to disclose how they segregated the Omnia network. And what Horizon disclosed was, quote unquote, it was other business reasons. It was not quality. You would think it was quality or cost. They disclosed when forced, it was, quote unquote, other business reasons. My point, the carrier models have no transparency. So while you might think to yourself, well, if we use the tier one network with the carrier, our costs are going down. Remember, you're in a pool and you don't know what those costs are. For all you know, and maybe I'm wrong, maybe I'm right, those providers actually get paid more. Maybe they do, maybe they don't. I don't know. You don't know because they don't tell you. When we talk about Door B or our tiered network, if you want to refer to it like that, everyone we're steering people to is a higher quality provider, which can be documented through the facts we share with the member. And they're always lower cost providers, typically through a literal direct contract or a single case agreement, which offer extremely low reimbursements relative to PPOs. So we're optimizing these plans for you. The carriers are optimizing the plans for them. That's the key to remember: transparency and optimization.
Excellent. Thank you, John.
Well
And I see a
said.
question from Cynthia. It says, what is the smallest group you'll consider? And do you operate nationally, all states? How about internationally? So Wellnet focuses on employer groups that have 100 to 5,000 employees that are either fully insured or self-insured already. We operate all over the country. We typically have customers that are in about 24 markets. Let's call it the NFL cities. And in terms of operating internationally, we do not sell our solutions to, international employer groups. There's a question here from Audra. It says, can you repeat your statement about Wellnet sharing the program with brokers and networks, but do not work directly with them? Let me just clarify. Yeah, go ahead, John.
Yeah, I was going to say, here's my version of that, how to explain this. We own 100% of the groups we sell are sold in conjunction with consultants. We don't sell anything direct to employers. But if we exclusively depended on consultants to market Wellnet's product, we would be out of business. Most of the consultants in the US have all their business, or the lion's share of it, with the big national carriers. So for a company like Wellnet, David to Goliath, to succeed in this crazy healthcare business, we have to shake the trees. We have to shake every employer out there. But the first thing we do when we talk with an employer is we say, who's your consultant? And we bring them into the conversation. So everything we do is sold through brokers, but we definitely market direct because that's what gets the action. That's what gets clients to say yes. We need the buy-in from the C-suite. Can't just be HR. We need the buy-in from HR, the C-suite, and the consultant. Everyone in the same room, Wellnet typically wins.
Terrific. There's a question from Luann. It says, do we work with Exponent HR? I have a group that thinks it's vital that their providers work seamlessly with them. And so Wellnet has a variety of direct contracts all over the nation. Off the top of my head, I can't recall if we work with Exponent, but we can certainly investigate. And frankly, if we do not, our technology chassis that we actually use to run these plans, it's an open API. So we can plug in any provider at any time. And it's really a matter of just creating a direct contract with them. Megan, any other questions that you're seeing as well?
Yes, there is a question that just came in through the Q&A. In the early part of the presentation, it sounded like the initial year with Wellnet, we would have the similar program with our previous PPO, with the claim savings coming in the first year from working with the concierge, correct?
Correct. I would call that, in super simple terms, our crawl approach. Meet you where you are by mirroring the plan designs that you've got. So no one says, oh my God, you're changing everything. So we mirror what you've got, and then we offer employees that voluntary path where they can pay nothing and work with a Wellnet concierge advocate.
Terrific. And I see a question says from Michael. It says, who is the C-suite that you refer to? So when you're dealing with the third or fourth biggest expense, right, you've got to play with everybody that's required for decision making. One of the reasons that Johnny asked us, and I didn't share this early on in the beginning of the presentation with SHRM, asked us to be there, was that SHRM is looking to elevate HR's position at the executive table, right? This is a finance-based sale. And so when you have HR, when you have CFO or CEO or president, right, this is a conversation that requires executive buy-in. And so we work in conjunction with the HR community, but always the meetings must be had with anybody who is responsible with the or for the P&L of the company, because it always comes down to the finance, not just the culture. Megan, any other questions?
We do have one last question that I see came up. This seems to be a lot of change. How do you implement this in a culture and with employee reception?
So to me, it's super easy, and we see this work all the time. I'll give you a couple of ideas here. Change can be difficult, but change can be beautiful. For everyone on the line that's been doing this for more than 10 years, think back. we were doing things way differently 10 years ago, 15 years ago, 20 years ago. What we do today is so much easier than it was then. With email, with cell phones, that might seem crazy, but for many of us, that we didn't have that stuff back then. So change can be very beautiful. Change is required in our world. When we developed this talk track of crawl, walk, and run, it was to address that very question. We know that employers want to save money, no duh. The problem is they don't want to make the changes necessary to save 20, 30, 40%. So what we're giving them the ability to do is implement change at a very slow pace. Crawl before you walk, walk before you run. Reference-based pricing saves clients a ton of money, but the change needed to get there is great. For it to run smoothly, the change is great. And so what we've given you the ability to do is move to an opt-out strategy like Wellnet, where we mirror the plan designs people had. So we can look them in the eye and say, you've got the same exact plans, except the network's different. Instead of Blue Cross, it's this national PPO network, but the plans are exactly the same. There's not much explanation needed. There's no change in that scenario other than the network. But as Keith alluded to, that's easy to fix any holes in it. And then we enhance the plan. This is really important. We're improving the plan by giving people this option. So it's like good news. It's not bad news. When we roll this out to members, when you do it right, it's good news. And the best advice I can give you is before we go live, we always try and get one of the C-suite members, some higher up in the organization, to speak with one of our advocates, so that when we do this open enrollment meeting, they can stand up there with us and give their testimonial about why this is all so important. As we've said numerous times here, when you have C-suite buy-in, change is way easier than when you're forcing change down the throat and the C-suite's on some other plan because they don't like the group plan. I mean, we have to have everyone in this together. And then what we've seen as an example is employees, faithful, loyal employees, want the best things for their companies. So when employees start to understand the things we're talking about here, they want to speak with an advocate because they know it not only helps them and their family, it actually helps the company. If you're an ESOP, if you're some employee-owned cooperative, whatever it is, think about how powerful this is. The more the plan saves, the more money all these people make. It's extremely powerful. We just have to work through it. Change can be beautiful, but we have to make it so.
Terrific. John, thank you. And thank you everybody for joining us today. We're going to share not only the recording of this presentation, the PowerPoint presentation, but also a one-page, let's call it cheat sheet talk track, as we know everybody, including yourselves, are limited on time. So we look forward to having conversations offline. We're happy to host meetings, virtual or in person, where masked up and can be done. And we have a team all over the nation to assist in, as we like to say, controlling the uncontrollable. Thank you for joining us.
Thank you, everyone.